I'm Jane Ransom, the Executive Director of the American Brain Foundation. And in a moment, I'm going to turn the program over to the chair of our board, Dr. David Dodick. But I first want to thank tonight's host, Blanche Hawkins. For as long as I've known Blanche, she's been passionately interested in curbing violence against women. And she's been very involved as a leading volunteer for Cornerstone Advocacy, which provides domestic violence services in the Twin Cities. And then she brought that same passion along to the Women's Foundation of Minnesota, where I had the privilege of working with her when she was chair of the board and I was executive director. And in the interim, Blanche had an accident and suffered a concussion, through which she became interested in traumatic brain injury and brain health. So because of these twin interests in TBI and domestic violence, she's really the perfect host for tonight. And I thank her for generously hosting and inviting friends to this event. And so now I'd like to turn the show over to Dr. David Dodick, the chair of the American Brain Foundation Board, professor of neurology at the Mayo Clinic College of Medicine in Scottsdale, Arizona. And he's the director of the Headache and Sports Neurology Concussion Program at the Mayo Clinic of Arizona. David?
Thank you, Jane. Good evening, everyone. Thank you. I want to welcome you all and thank you for making time tonight. I also want to thank those of you who have generously given to the American Brain Foundation to allow us and our partner, the American Academy of Neurology, support the groundbreaking research that will truly advance treatment, I think, and ultimately lead to cures for the brain diseases that affect 1 in every 6 people on this planet. And to show our appreciation and to ensure we keep you all updated, we host these events on important issues and advances related to brain diseases. So tonight we'll be discussing, I think, a crucially important topic. So you know that concussion, or mild traumatic brain injury as it's sometimes called, which of course there's nothing mild about it, is a change or an alteration in the normal function of the brain that is often associated with an injury that affects the structural integrity of the brain. You know, the World Health Organization estimates that, conservatively speaking, there are over 60 million people, including millions of Americans, who sustain a traumatic brain injury every year. And the public has come to know of concussions largely through the lens of contact sports and our military operators. But there's also a true crisis of traumatic brain injuries occurring every day, but in plain sight, but hidden behind closed doors. And that is the traumatic brain injury that affects women who are victims of domestic violence, or as it's frequently referred to now, intimate partner violence, which actually affects more than 1 in 4 women who are subjected to this kind of violence, and traumatic brain injuries are thought to occur in at least 75% of them. So this evening, we're fortunate to have really an incredible group to discuss this issue. Elizabeth Vera is a domestic violence advocate with more than 28 years of experience in the domestic violence field, having developed programs for nonprofits nationwide. And she's worked on awareness campaigns as well as crisis and intervention counseling with victims and offenders. Elizabeth's introduction into the world of domestic violence and traumatic brain injury was a result of being in an abusive relationship with her husband for 18 years. And the violence escalated and directly impacted both of her children at the time, who were assaulted and suffered traumatic brain injuries as well. Elizabeth's one of several who appeared in the film we're going to talk about tonight to share her story with the world in her quest to prevent another woman or child from experiencing abuse and traumatic brain injury. We're fortunate to have Dr. Valera with us tonight, who is an associate professor of psychiatry at Harvard University. She's the director of the Valera lab, her own lab, and one of the world's leading neuroscience researchers on the impact to the brain from abuse related to domestic violence. Her research has led to really important insights into just how common traumatic brain injury is in victims of domestic violence, And using functional and structural brain imaging techniques, she's uncovering how the brain changes in women who are victims of domestic violence. And finally, we have a special guest tonight, Sydney Scotia, who is a singer, a songwriter, a screenwriter, an award-winning actor, producer, and director. She's also the creator, the writer, producer, and director of the film This Hits Home. The film recently premiered at the Boston International Film Festival, where it won the Audience Choice Award. And it also screened in October of this past year at the Independent Montreal Film Festival, where it won the award for Best Written Screenplay. But before we begin speaking with Sydney and our guests, I'd like to actually roll the trailer for the film.
People often think of it as something that happens to other people or it happens over there. Most people know at least one person, even if they don't know it.
Half of me was thinking, oh my God, is this going to be the last one? And the other half of me was thinking, I hope it is. I hope he just ends it now.
I had my head slammed into walls over 70 times.
From what the officer said, punched me in the face about 20 times. I almost had to have surgery.
I said something he didn't like, and the next thing you know, I was covering my head up.
He would drag her across the lawn.
Strangled me until my eyes rolled back in my head and
the abuse would just kind of happen on a daily basis, always aimed at my head.
You get hit on a regular basis, that can be the trigger for this devastating disease.
There's no reason to believe that the hit that a woman takes during an episode of domestic violence is going to be any different or any less significant to her brain than the hit that a football player might experience on the field.
They are having their head smashed against walls, sustaining concussions, traumatic brain injuries. I like to use the word traumatic brain injuries because I think it's really what it is. Concussion almost minimizes what it is.
If a person experiences a high dose of those hits over a lifetime, some individuals develop a condition called chronic traumatic encephalopathy.
It is a neurodegenerative disease that is very similar to Alzheimer's disease.
Domestic violence victims can definitely develop chronic traumatic encephalopathy.
I've never had a domestic violence homicide autopsy before. The level of head trauma that I documented made me think that there's a possibility that this person could have CTE. And I hope I never see a case like this ever again.
Difficult thinking is probably the biggest part. It impacts all part of my day.
We weren't playing in a football field. We weren't fighting a war. The battle was in my home.
We need people to recognize this for the public health epidemic that it is.
Sydney, let me ask you, what inspired you to make this film?
Well, first of all, thank you to the American Brain Foundation for having me tonight and talking about this film. Thank you to Liz and Eve for being here. You know, my father, who is a neurologist, was asked to visit a local shelter in Arizona and was asked to establish a traumatic brain injury clinic. And at the time, we had no idea what that meant, why they would need such a thing. It didn't click. And when he returned home, he was visibly shaken by what he'd seen, and that these women and these children and pets have to fear for their lives in a high security shelter it was heartbreaking. And that they had to use coupons to buy basic necessities and be sheltered from their outside lives, be torn away from those lives for fear of their own safety. And so I loaded up everything I could. You know, I packed up all the clothes and toys and donations that I could. But after leaving the shelter that day, I knew that that really wasn't enough. So I was later introduced to Maria Gorai, who I learned her struggle over the years to find out what happened to her mother, who sustained 40 years of abuse, primarily to the head, and rapidly deteriorated and had early onset dementia, and nobody could figure out what was wrong. So Maria, she speculated that this could be CTE because there was so much in the press at that time about chronic traumatic encephalopathy, which is a neurodegenerative brain disease, and so much of surrounding football players and professional athletes. But nobody had made the connection between domestic violence and neurodegenerative brain diseases. So once I heard that, I knew that filmmaking was a specialty of mine and something that was a passion of mine and also this topic. So I've spent the last 3.5 years focused solely on this film and getting this topic out there. So that's what inspired it, really.
Thanks, Sydney. Tell me, what did you learn making this film that you didn't know going into it?
Well, I mean, where do I start? I didn't know. I knew what chronic traumatic encephalopathy was going into this. And I had an idea of an emotional trauma that these women must suffer in these relationships. But then I realized I really didn't. I didn't understand the brutal physical trauma that 1 in 4 women will endure in this lifetime. And I also learned that women's brains are more susceptible to these neurodegenerative brain diseases than men because of the way their nerve fibers work. So the long-term damage for these women can potentially be much more serious. And there's no way to track these traumatic brain injuries that they're having because they're all happening behind closed doors. And some of these women detailed 5-hour-long episodes of abuse, sometimes days, and it was nonstop. And so the medical community tends to focus on the external injuries. One woman in the film told me that she had all of her teeth knocked out in an episode of domestic abuse. And so she's going to be focusing on that rather than the fact that her brain was also severely injured in that episode. And, we took Maria's mother's brain and over several years made sure that it got to Dr. Ann McKee, who is a leading neuropathologist in the field out of Boston University. And so uncovering that process, we follow that story. I just learned so much throughout that process. I learned that there need to be structural changes within the justice system, and these women desperately need to be protected, and questions need to be asked at a doctor's office. And we need to start recognizing this for the public health crisis that it really is, as Eve so eloquently states in the film. And this is why I don't feel like this film is enough. It's the first step, but there needs to be so much more done. And that's why I've partnered with Maria to launch this foundation, the Panfila Domestic Violence Hope Foundation. That's her foundation that she's created over the making of this film, and is going to be launched at the same time as when the film comes out. And then the American Brain Foundation Traumatic Brain Injury Fund is also a really important step to making sure that this serious issue gets the research that it deserves, as well as the Precon Health Foundation, which I've joined the board of, which is dedicated to making sure that women's brain health, specifically victims of domestic violence, is getting the recognition that it deserves.
So the film sounds like it was just the end of the beginning. You're just getting started on this. As I said earlier, your film premiered at the Boston Film Festival and actually won the Audience Award, which is arguably one of the most prestigious awards that a film can be given at these film festivals. And so did it surprise you that a film that has as its focus such a tragic and difficult topic was actually chosen by the audience as its favorite?
Well, yes and no. I mean, I think this film exposes not just a social crisis, but a public health crisis. That more than 25% of women are dealing with. And the public, the vast majority of people have no idea that this is going on. I mean, I had no idea. And a lot of the very established medical professionals that I talked to couldn't speak to it. I mean, their research hasn't been done, and nobody has connected these dots. And so I mean, while this is a very serious and heavy topic, I'm very biased. But once you hear the stories of these women and watch this film, I think it's impossible not to make this one of your causes of choice, because it's extremely powerful. These women are incredible. The story of their resilience and their passion toward using their voice to now help other women is one of the most inspiring things I've ever seen. And also the passion and commitment of the scientists and these intimate partner violence experts and public health officials and policy and lawmakers. There's not a lot of information there, but they are so dedicated to making sure that it does get out there. And once they sit down and talked with me about it, it kind of almost lit a fire in them talking about it. And so I think at the end of the day, it's a story of hope. And once you get through the whole film, although it is a journey, it really is quite inspiring. So I think you can't leave without a sense of hope and feeling inspired by the end of it.
Thank you, Sydney. Maybe Elizabeth, if I can, I'd like to ask you a couple of questions.
Absolutely.
It's been reported that 75 to 90% of women who are victims of domestic violence experience traumatic brain injuries because, as was just shown in this trailer, the head is often the target. So can you talk to us about whether this was the case for you?
First of all, I really want to thank Dr. Maria Gorai because prior to meeting her, I had only thought about traumatic brain injury as something that my children had physically experienced because they needed extensive neurological interventions and care. And after those first conversations, I had never realized, wait a minute, like I took very similar hits as well. And it really kind of opened my eyes, and it's been a very personal process and journey to go back and look at what my experiences were, because as a mother, you sidetrack those to the side for your children. But yes, definitely one of the most important things in most survivors will share is that the primary targets are always the head first, because the eyes and the mouth are there, and that's usually what's being part of the engagement and the conflict. And even when we take a self-defensive stance, you know, the immediate sense is to cross your arms and cover your head, because there's that instinctive desire to protect. But, you know, in many cases, we are overpowered, and it's not just like physical, like hand injuries, it's being thrown into furniture and walls. I think for me, the two that really stood out for me was after I had delivered my daughter, on the way home, we entered an argument, and he literally got my hair and smashed my head right into the right car passenger window. And that, I was literally, I guess I could say unconscious for a bit. And then I was just so shocked and stunned. And so looking back, you know, definitely I've discovered things that I wasn't able to explain. Difficulties with memory, definitely sequencing. My short-term memory definitely is impacted. I need a lot of reminders, a lot of redirection. But, you know, just acknowledging that you had the trauma and being able to verbalize it doesn't necessarily mean you're ready to do the emotional processing part of it. Because once you acknowledge, like, I realized that this is what I was experiencing, the next step is seeking medical care. And when you seek medical care, you have to repeat your story and your history of injuries and medical history. And it can be very, very traumatic and overwhelming and triggering. And I know for me, there was a large time where I didn't want to address it or acknowledge it because it was just so emotionally overwhelming. But there's a point that you reach and you realize you have to take those steps to be evaluated, to be treated, to see what supportive services outside of behavioral health, when it comes to mental health and neurology and medication that can assist or support. I have a very hard time seeing the trailer. It's really difficult to feel like, in the beginning, I thought I had progressed so much, and then realized that I had also neglected so much, because the information is not there. The information is not available. And because in domestic violence cases, one of the things that happens is that people determine your injuries based off outward injuries that display. And so even if there's hits or blows to the head, you know, any bruises or welts are subdural and they're covered by the hair. And so, you know, law enforcement, you know, now as I move forward and I speak at events and trainings with law enforcement, I really emphasize the fact that just because a victim doesn't have outward external injuries doesn't mean she hasn't suffered significant blows to her head, because that is the very first place. So it's definitely redirected me, but it's very painful to, I get very frustrated and emotional when I can't remember something, or I miscalculate. Sometimes I lose a sense of time. Like I feel like I saw someone 3 months ago, but it's only been 2 weeks. And it's really difficult to cope with those feelings because you want to feel normal. You want to feel functional. And I think for me, I've pushed myself so hard to move forward and, you know, not really taking inventory of what my trauma was, both physical and emotional, because I focus so much on Anthony and Raylene. And it's very hard to see Anthony, my son, you know, he's now going to be 29. And because of the trauma, he had like retinal injuries and tearing. And so he has eye injuries, headaches. He also has a lot of difficulties with short-term memory and sequencing, auditory processing. And as a mother, when I see him and I see the, you know, glimpses of the difficulties, it takes me right back to that feeling of like, how could I just so much anger and guilt about why I didn't know different. And I didn't know to do better. And this was in the 1990s. And so this information and these conversations were non-existent.
Elizabeth, are you getting the care that you need, the medical care that you need?
You know, I appreciate that question because I think it's really important. I realized that when I went to my primary health care after my initial conversations with Dr. Gorai, is that, you know, your primary care physicians don't always understand what you're saying. Particularly when it comes to sharing your trauma, because one of the things I've learned is that my situation was so extreme that it was staggering and that it was numbing and that it was not palatable. And so sometimes treatment providers want to hear you, but after it becomes so unreal, they just, it shuts them down. And also because they don't necessarily understand and have the knowledge about how far the field has emerged and how strong and how much information and even next steps. And so it took me 8 months to try to get a referral and to a neurologist. And even with it doesn't follow through. You know, my HMO didn't approve it because they'd never heard of they didn't understand why my trauma meant I needed to see a neurologist. And so I was turned down for, you know, neurology appointments, or if I asked for x-rays or CAT scans, they weren't approved because in their mind, I hadn't sustained any injury. And so it was just really, really, really difficult to access services. And it continues to be a struggle.
So, I mean, the lack of awareness of the relationship between domestic violence and traumatic brain injuries is still incredibly pervasive, which is why I think this film is going to open a lot of people's eyes when they see it.
Yeah, definitely.
It's a segue to Dr. Valera, who is, sort of a pioneer in this field, and whose singular focus for her career has been on studying the brains of women who are victims of domestic violence. So Dr. Valera, thank you for being here. Domestic violence against women is obviously not a new issue, but traumatic brain injury is not a new issue either. Yet you, as a pioneer in this field, remain one of the very few who focus their research on this desperately important issue. So my question is, why is that? What inspired your commitment to this issue, and what can be done to draw more attention to this public health crisis, as you've heard described amongst other scientists and clinicians?
Thank you for having me. I want to say first, this is, as anyone who knows me knows, it's a topic that's near and dear to my heart. I am extremely passionate about this. It is true that I'm, definitely one of the first people to, work on this area, at least publish in this area. There have been some others who have been out there for a while. And then now, luckily, there is a growing group of people who are doing this. So that's one really bright spot in all of this. That said, when I started doing this in the 90s, I was doing volunteer work in a domestic violence shelter, and working with these women. And I would hear the stories, and it became obvious that women were getting hit in the head in all sorts of ways that could definitely be pretty severe. And I was also being trained in my doctoral program about basically brain injuries and neuropsychology and structure function relationships. And so it just seemed really obvious to me that if a woman's getting hit in the head with a bat or a hammer or getting her head stomped on, that something could be going on there, such as a brain injury. But when I did a lit search, there was absolutely nothing in the field. Not a single article came up, and there wasn't anything at that time at all. So at that point, I just decided this was something I needed to find out more about, so we would know what's going on here. Are women sustaining concussions or brain injuries? Because it sure seems like they are. And to what degree? And then is that related to how they may be able to function in their lives? And as Liz said, is it, for example, related to difficulties in memory or learning, or related to what people always thought of, is the psychological trauma of being in a relationship? Is it related to the problems that they always report with depression or anxiety or worry? Because a lot of the symptoms that women historically have reported, women who have been in partner violence situations, those problems are really a host of post-concussive symptoms. And so it really fit perfectly and made a lot of sense that this could be going on. And it was truly astonishing that nothing was being done in this area. And one interesting point about this is that there wasn't a lot either in athletics, for example, or in the military. I remember there was some soccer articles about if you head the ball, people worried about heading the ball, but nothing else really. And I remember thinking, man, football's got to be crazy dangerous. But, I didn't care. That wasn't a passion of mine. And I just figured, then you got to fight the NFL and stuff. It's America's pastime. Whoever wants to say that's going to be dangerous. And here we are now. There's tons and tons of researchers and money and information for very rich and professional athletes and people who are, in the military as well. These people, mostly men, get tons and tons of attention, have tons of research on them. And so they have an awareness that what they have experienced, an awareness by external people, what they've experienced may have been a brain injury. And so people are looking for that. They're expecting it. And it's not something that's like, oh, wait, you did what? No, we've never heard of that. You shouldn't get back out on the field. You don't feel right. It used to be a badge of honor. But I got a big dinger. I could barely get up, but I got right back out there. Nowadays, they don't do that. There's a concussion protocol. You have to stop playing, and then you can go back once you reach certain guidelines. And women who are in partner violence situations don't have anything like that. They don't get a break in what they have to do every day or anything like that. So there's really been this really disjoint in how fields have come forward, because I was able to publish a paper, and there was a couple other published on brain injuries and repetitive brain injuries in women who have experienced violence in the early 2000s. But unfortunately, what happened, I don't know exactly why. I mean, I could talk a little bit on why it's probably not the case, but as it turns out, people are more interested in studying athletes and military personnel who are largely males. So we know very little about what's going on in the female brain, period, when it comes to brain injury, and even less about what's going on for women who are experiencing intimate partner violence. I did want to take one little side step just to mention, as I hear Liz speak, and something that I try to do before my lectures, is to say that this topic is triggering for a lot of people. And by the numbers alone, somebody on this call, aside from Liz, has probably experienced intimate partner violence if there's more than a handful of women. And so if it is triggering for anyone, I do hope that you can take care of yourself or reach out to somebody. You could always reach out to me if you have any questions or any concerns or thoughts, because it's not always easy. And sometimes you think, like Liz said, I thought I had dealt with that, but then I saw this stuff and it brought up stuff. So it's okay to talk about it, and it's okay to bring it out. And there are people who can help. I'm one of them if you would choose to. And I didn't want to forget to say that, because I do like mentioning that this type of stuff can be very triggering. It is really
thank you for saying that. I appreciate you saying that. And I too will put myself out there. Please, if anybody has any questions or needs help, please reach out to Dr. Valera or I. We're here to help. And Dr. Valera, since you've been sort of a lone voice for a long time, fortunately you are, there are many more people being attracted to this area, thank goodness. But can you tell us what exactly has been your area of focus in your research, and what can you tell this audience about what you've learned that you'd like to share with this group about what your research has shown? Absolutely.
So in my primary study that really basically said, yeah, this is a serious issue that we need to address, I basically showed, now again, I don't know if you were to do epidemiological study, if we would get the same type of numbers, but 74% of the women that I interviewed in that first study of 99 women reported at least one traumatic brain injury. Some of them were moderate to severe, but it was at least mild traumatic brain injury from a partner. And so that was really startling to me. I knew it was happening, but at such a high rate, I was like, wow. But what was even more disconcerting was the fact that it wasn't just one brain injury. Okay, someone could argue, well, yeah, one mild brain injury, is that really such a big deal, right? I mean, don't most people recover from a mild traumatic brain injury or concussion, and they're kind of doing their own thing, there's no long-term effects? That may be right. And sure, a lot of people do, though there is that percent that continue to have long-term effects. But for the women who I talked to, over 50% reported repetitive traumatic brain injuries from their partners. It wasn't usually just 2 or 3 or 4. For some of these women, it was literally too many to count. We have an example where their partner literally would knock their head into the wall every time they walked by them, just because. And in the words of one of the women that I spoke to, and if he was having a really bad day, it would be a real doozy. And so they would have, this period of disorientation repeatedly, and this may last for years. One woman was trying to get out of the relationship for quite some time, and she was terrified too, because she didn't really have a good place to go. He had threatened to kill her if she ever left. And she ultimately had to wait for him to go away into the military, and then she snuck out of the house in the middle of the night and never went back. But she had to have a plan, and she had to get help. So I think some people find, as Liz said, it's really actually hard to believe that this can happen. And I think some people think, she's exaggerating, they're exaggerating, or, well, these are just the extreme cases. And they are extreme cases, but they're not rare. They're not rare. And it's hard to believe that someone can endure this, but I have spoken to a lot of women who genuinely do. When I speak to women, they have no reason to make things up. And the stories I have heard are horrifying. And there are lots of reasons. And again, I don't have all the time in the world here, but lots and lots of reasons why they may not be able to escape that relationship. And some of them is for fear of their own lives, which is a really true fear. And just to follow up on the rest of the question, the other thing that I discovered was not just that a lot of people were sustaining brain injuries or a lot of brain injuries, is that the number and recency and severity of these brain injuries were associated with a woman's ability to learn and remember a list of words that were read to her, and also her ability to perform a cognitive flexibility task, so kind of switching back and forth quickly. And the more brain injuries you had, also the higher levels of depression, anxiety, worry, and PTSD symptomatology the woman had. So it wasn't just that we're recording these brain injuries and it's not related to anything, it was. And statistically speaking, I could control for the fact of whether or not this was just sort of the abusive situation. So, oh, it's really just because she's in this abusive relationship, it's psychologically stressful, so of course you're gonna have problems. No, I could statistically control for the level of abuse and the brain injury association was still solid. Okay, so I'm not gonna say the abuse severity won't matter, and it might, because of course that's horrifying too, and emotional abuse can be terrible. You know, there's all sorts of, you know, abuse that's just horrible in so many ways, but the brain injury does have a strong association with these other difficulties. In my more recent work, I've shown, you know, I basically wanted to use some of the imaging tools that people have used more recently to look at athletes and military folks, again, because that's where we see most of the research going on in the TBI field. And so I used neuroimaging and I looked at structural and functional connectivity, and again, found that the number, recency, and severity of brain injuries was associated with both structural and functional connectivity in the women that I had studied. And not only that, but in the functional connectivity paper, the region that I looked at was also associated with a woman's ability to learn and remember a list of words. So basically what it was saying was, yeah, the more brain injuries you have, the more difficulty these two networks in your brain can communicate with one another. And the less communication these networks have with each other, the more difficult it is for a woman to remember and learn a list of words. So real life consequences. I also have some preliminary data on strangulation, but that's not quite out yet. So I'll leave it at that. But I'll just say that I'm very interested in strangulation as well, because that can basically, that's an acquired brain injury. It's not necessarily a TBI per se, but when oxygen is cut off from the brain, you can sustain brain injuries and you can have an alteration in consciousness just like you do in a TBI. And the women that I've spoken to have often had high rates of strangulations, and again, repetitive strangulations. So it's just even yet a different type of trauma to the brain. And so now you have psychological issues going on. You have trauma from a traumatic brain injury to the brain, and also some potential hypoxic or ischemic trauma to the brain. And we don't yet know how all these things interact. We have so much to learn so that we can actually understand this. And well, I'm going to stop now because you may ask me another question. But those are some of the things that I have basically discovered, so to speak, in my work, and I'm actively working on doing more currently. I'll never have a shortage of things to look at because so little has been looked at so far.
For sure. So one shouldn't be surprised that these women, unfortunately, continue to struggle cognitively when they're, as you say, the structural and functional connectivity, the way the brain is wired, and areas of the brain that are supposed to communicate with one another no longer do in the same way. So it shouldn't be surprising that we're seeing some of the things that Liz says that she's struggling with. Exactly. That would make sense given what you found. I want to ask you one more question. You know, the National Institutes of Health and the Defense and Veterans Brain Injury Center and the Center for Neuroscience and Regenerative Medicine just convened a panel, and you led that, and you published a seminal piece of work on understanding traumatic brain injury in females. So could you just give us sort of the highlights of what came out of that initiative, what the conclusions were, and what the future holds?
Well, I mean, the one of the main points is again, it's kind of sad in a way, because one of the main points is that there's really not a lot of data on TBI in women. Most of the data that we have on TBI, and most of what we based all recommendations on, neurorehabilitation on, et cetera, is based on what we have learned from men. And oftentimes strong, healthy men, because they may be premier athletes or they may be in the military. And so we know very little about what is actually going on with a traumatic brain injury in females. We can assume it's similar to what we see in males, but that's not always the case. And there are some of the data that we talked about in that paper basically shows where there are some differences. But ultimately, we had this first symposium by NIH and others that you mentioned in DC, and I guess it's been about three years or so now. And it's like, okay, we're gonna take what we talked about there when we said there's not a lot, and now it's several years later, so let's update everything and see what else we have. And there wasn't a lot to update. So there's a real lack of research on female brains, and there are neurobiological bases for why the female brain may be different. The whole issue of hormones is really important. In fact, within a woman herself, depending on what stage of your menstrual cycle you're in, you may have a better or worse prognostic outcome if you sustain a TBI during that time. And so if you say that just within a woman that may happen, well, then how are hormones playing a role if you're going from women to men? And then the whole idea of whether or not, we know that men's necks tend to be thicker and stronger. And so it's going to help hold the brain in place a little bit, or, help hold the head in place a little bit better. So to absorb some of that shock if there's hit. So there's a number of different factors that make us believe, make us understand why there could be differences between men and women. And I would say on average, the jury's out, but when it comes to concussion, women tend to sustain concussions a little bit easier, and they tend to have a slightly longer time to recover. So if anything, when we really do get down to doing the research here, I think we're going to find out that women are on the worse end of concussions than are men, unfortunately. So with respect to that paper, one of the real take-home messages is we can't just keep excluding women from research because it's inconvenient to study them because they have their cycles or whatever. There weren't enough women in this group, so we just didn't study any of them. Even in preclinical studies where we're studying animals, females are often excluded because, again, it's harder because you have to deal with the hormones. So the push for NIH is to include more women in studies and justify a lack of inclusion of women in studies. And we really need that. So we're at a very early stage of truly understanding, men versus women in terms of brain injury, or understanding really lots of things about the brain, and in science in general, because unless it's a real female specific disease or disorder, men are primarily studied. And I think some of the female disorders are studied less overall. So I think that was definitely one of the take-home messages that we need to start taking into consideration hormones, including females, having a study where you can actually collect data that has both male and female data in it so you can compare them. And then, of course, we raise the issue of intimate partner violence, which has been largely ignored for all these years.
Yeah. Well, all I can say is thank you for what you do. I hardly have to say keep it up. But what I will say is you need more funding for what you do. That is for sure.
Absolutely.
So Sydney, back to you. I read an article about you that talked about how you put your heart and soul into telling this such an important story and how impressive this documentary is. And you've now set up your own production company, and they can't wait to see what she does next, which is what was said. So now I'll ask you, what is next for this film and what are you working on next?
Well, my singular focus is to get this documentary seen by as many eyes around the globe as possible. Because this is a global crisis that has only been made so much worse because of the pandemic. You know, there's been a dramatic increase in intimate partner violence that's captured the attention of the US Congress and United Nations because these women are stuck at home with their abusers. So it's worse now than ever. So I'm actively in discussions with distribution platforms and several major multinational corporate entities who have made this issue their main focus as well. I do have a number of other projects in development right now, and relevant to this group is another feature documentary about a very common brain disease that still remains fatal, and there's been very little progress on, as well as a documentary series about some more rare and fascinating brain diseases. So I hope that these capture the attention of the public, because like American Brain Foundation says, if you can cure one, you can cure many. So that is now what I'm working on. But I want to take a moment to thank everybody who tuned in today. Thank you all for being here.
Thank you, Sydney. We do have about 10 minutes or so left, and I'd like to open this up for any of you who have questions for Sydney, Dr. Valera, or for Elizabeth. Please.
Yes, my name is Umi Hankins, and I'd like to ask Dr. Valera if she was able to garner anything or have any insights regarding research on women who play soccer. I have a granddaughter that played soccer, and we were always very concerned about brain injury, the size of women's necks, and those kinds of things. So were you able to have any insights from possibly that field as well?
So that's actually, it's interesting because soccer has been the one sport that has long been sort of looked at. And there have been some studies that have come out. I'm not sure if it has been, there may have been something on female soccer players. I don't recall exactly. I mean, that's not what I'm doing in my research. But there definitely have been some studies that have sort of shown some association with, for example, number of hits to the head and a measure of structural brain connectivity, which is called fractional anisotropy. So what exactly that means, you know, I don't know exactly because they didn't necessarily correlate it with some type of functional outcome. But there have been some studies that have shown some association with number of headings or number of concussions. One of the things that I've heard sort of anecdotally, or maybe just when I think about it, when I look at my son plays soccer, and he doesn't head yet because he's young, but we'll watch soccer sometimes. And what concerns me is when two players go up together to get the ball and they collide heads, or when somebody is jumping and somebody else's foot goes and hits somebody in the head. And I've seen these things. And that's the thing that definitely I would be concerned about. So if someone's playing soccer, I'm definitely very concerned about the potential collisions like that. And number of headings is a different story. Like right now, I would not really want my son to head the ball at this point. He still has some years, so hopefully we'll know a little bit more at that point. Because there are some data suggesting that it's not a good idea, certainly for a younger brain. But you know, I think the rules of the game have changed somewhat. They don't allow heading younger when they think it would be more dangerous. So I don't have the best answer for you. There's probably some people who study sports concussions and would know that answer, you know, a lot better. Actually, there's probably somebody on this call, I think, who might know that answer.
Right. And I really wasn't trying to delve into the soccer, but to see if there was research in that area that you may be able to use in looking at brain injury for domestic violence survivors.
No, and that's a great idea, and you're right. And so what I actually did was, see, soccer doesn't seem necessarily enough to me, so I looked at football. So I looked at that. My structural connectivity study was based on results from repetitive hits to the head from football players. So basically in this one study, they found that in the posterior and superior coronal radiata, in one or two other regions, they found that this measure of water diffusion called fractional anisotropy was associated with the number of hits they had, or maybe it was just maybe it was dichotomous. I forget the exact details, but it was definitely an indication that, yeah, so the people who had sustained a lot of hits to the head, this was a problem area in the brain. And so I said, well, if we take these regions and we look specifically in these regions in the women who have experienced partner violence, can we see an association there as well? And we did for 2 of the 3 regions that we looked at. So that's a great idea. And that's what I have been doing, not necessarily in females, but in males, because, you know, I don't have the luxury of going to other female data necessarily, or, you know, sports even on females. And in my other, the functional imaging paper, I actually got ideas just from some groups. So this one group in particular that has done some really solid work looking at functional connectivity and how it relates to traumatic brain injuries. And so they found some evidence repeatedly. So it's like sometimes you get studies and especially in imaging, and one person finds this, somebody else finds this, somebody finds this, but this had been a repeated finding. So I said, okay, I feel more confident about this. So can we see this in the women? And lo and behold, we saw a very similar type thing. So I think you've hit the nail on the head in a way that we have, that when I do my research, I have to sort of guide some of it by using other data. But we don't want to say that those data can inform how we're going to treat these women, because we don't know if we're going to get the same effect. We don't know if we're going to get the same result. But that's a good place to start, because, sort of, we could come up with our own ideas as well, based on neuropsychology or maybe preclinical trials. But it's definitely, worth a shot when you have repetitive injuries in other populations to look here as well.
I will say, Mrs. Hankins, that there has been an association between soccer players, both at the professional level and the collegiate level, where they seem to be at more risk for long-term neurological consequences. And to an earlier point that Dr. Valera made, where females are rarely the focus of research, there are a couple of recent studies where they actually got soccer players just to head the ball 20 times in 3 minutes and shot. Nobody was concussed. At least they didn't display outward symptoms, but they had a decline in their oculomotor function, in their vision. They had a decline in their cognitive function, and they actually measured a rise in the blood of a brain biomarker, we call it. So something leaking out of the brain just from heading the ball 20 times. And so it just goes to show you how little it takes to actually cause an injury. Heading the ball compared to what we're talking about here tonight, which is tremendous physical violence. So yes, we need more of that research on women's brains, because as was alluded to tonight, women's brains may be structurally more vulnerable to worse damage from the same degree of injury. So yeah, soccer, just to circle back to the question about soccer, there is a couple of questions here about how people are going to be able to see the film, Sydney, and what can people do to help?
Mm-hmm. Well, the film, like I said, we're currently discussing distribution with several major streaming platforms. So as soon as that information comes out, I'll be talking to Jane about doing a press release on the American Brain Foundation website, hopefully, and also getting that information out on my social media. It'll be everywhere. And you can also check thishitshome.com, which is my website. And that everything is there, every screening, every festival. And also under how you can help, there's a tab that says how you can help, is the American Brain Foundation link to the Traumatic Brain Injury Research Fund. That is there, as well as the Panfila Domestic Violence Hope Foundation, where women are pledging, domestic violence survivors are pledging their brains to research through a brain bank that Dr. Ann McKee is launching. So that is there, as well as Futures Without Violence. So that is where you can find all of the resources available. And thishitshome.com will also have all of the information about when the film will air, because I'm so excited for everybody to see it. And honestly, I can't wait. I can't wait any longer for everybody to see this. So as soon as I know, you will know.
Thank you, Sydney. Does anybody else, I must say that, again, the launch of the film was just the beginning. It seems like a research brain bank has been set up, a foundation has been set up to support these women, the American Brain Foundation's research fund. So you're hitting the patient care aspect, the research, as well as the educational aspect that's so desperately needed. So well done. Does anybody have any, in the 3 or 4 remaining minutes, anybody have any other questions for anyone on the panel?
It looks like we did have a question from Valerie.
Yes, from Valerie. It says, why isn't there more funding for research, and who is the target audience to go after more resources? Come on, Dr. Valera, tell us.
Well, I mean, funding, you know, especially, well, in the United States, I mean, there's, you know, I know I have colleagues in Canada and other places where funding is a little different, but, you know, the big grants are often through the National Institutes of Health. And certainly there, at the very least, you basically need to have almost done the work before you can get some money. You need to at least have done some of it. You need to have evidence. So one of the things that I really want to look at, the long-term effects of brain injuries on women who experience partner violence related TDI. But for me to get an R01 on that, I need to basically collect data already and say, see, there's evidence here. So please give me money so I can do a full study on this. So so for me, one of the things that I had worked really hard at was trying to get money and then scrape together things that I could do this study. So that the imaging studies that I published, which are the only imaging studies on this topic out there right now, IPV related TBI. I mean, I think there may be some people working on this now. I know of a colleague who's either starting to or about to, but right now that's all we have. The reason I was able to do that was because I got $30,000 from a Center of Excellence grant at Harvard. And then I did all the interviews myself. And then I cobbled together like volunteer interns doing this and doing that. And then a postdoc finally, who was really, really bright, who was able to help me with the analyses. But basically but that study, those 2 papers should have cost a lot more money, but I needed that in order to get the R1 that I now have to do a bigger study. So I'd like to look at the long-term effects, but how do I get the money to, so philanthropic funding is really nice. It's a nice way to get people started and to get things started. So that then you can try to apply for bigger funds through NIH and stuff. But I think that a lot of places don't necessarily value this type of research for some reason, because partner violence is very misunderstood and not appreciated the way it should be. But anyway, I think that's those are part of the issues, and I don't want to take up too much more time, but we definitely need more funding so that we can do the research and then to get more funding, et cetera.
Thank you. Well, there's some excellent questions here, but unfortunately, we're not going to be able to get to them. I'm so sorry, but this has been a great evening. Dr. Valera, thank you for being here, and thank you again for what you're doing. And Elizabeth, thank you so much for being here. The courage that you and your children showed by coming forward and just telling your story on camera for the world to see was just incredible. I can hardly watch that. I can hardly watch the film. Every time I watch the film, I'm just so moved by Anthony and you and your story. And so just thank you for that. And Sydney, thank you for doing this. It's a groundbreaking piece of work. And I hope as many people across the world see this, because they absolutely need to see this. So thank you for doing that. Good luck with your future projects. And thank you again to Jane and Lisa and the American Brain Foundation for making tonight possible. And thank you for tuning in. Take care, everyone.
Thanks, everyone. Thanks so much for having me.
Thank you so much. Thank you, Sydney. Thank you.
Thank you.